All right, thank you everyone for joining tonight's webinar and welcome. We're pleased that you're joining tonight's webinar, Non-Clinical Healthcare Careers, Exploring the Role of Health IT. And for those who might not know about us, HOSA-Future Health Professionals is a student-led career and technical student organization empowering the next generation of leaders in the global health community. So we're really blessed to have a presence both inside and outside of the classroom, providing students all over the world with educational opportunities, collaborative opportunities, and engagement opportunities in healthcare. I'm Nick Ballard. I'm the International President of HOSA-Future Health Professionals this year, and I'm very excited to be learning more about the health IT professions with our panel of experts on tonight's call. We're thrilled that the Healthcare Information and Management Systems Society, or HIMSS, is supporting tonight's session. And a few housekeeping notes before we go ahead and kick things off. This session is being recorded, and we will be posting it and emailing the session to you after tonight's call. And you will receive a certificate of participation for attending. It'll be emailed to you within 24 to 48 hours. After tonight's webinar, there will be time for a Q&A after the panelists speak. Please feel free to use the chat function throughout or after their presentation for any questions that might come up. So without further ado, I'm happy to introduce the folks joining us on tonight's call. First, Emily Lee is a healthcare administrative leader dedicated to streamlining patient access to preventative care. Emily obtained her master's in healthcare administration from the University of Southern California in 2021 and completed her undergraduate studies in public health at San Jose State University. She's currently the new patient navigator team supervisor for the UCSF Primary Care Services Department, where she leads a team that helps patients bridge the gap in their medical care. Emily has 10 years of experience in the medical field and is passionate about making healthcare more accessible for patients who are non-native English speakers. Outside of work, Emily serves as the treasurer for the Northern California HIMSS chapter, where she manages the chapter financials and assists with coordinating chapter events. And Emily's hobbies include traveling, playing badminton, and crafting with her cricket machine. Connie Renda has been in the health information field since 1996. She is the founder of a health information services company in 2005 and sold the firm in 2013 to explore her passion to connect education with industry. She's currently the program director and professor of health information technology at Mesa College. She helped to develop the pilot Bachelor of Science degree in health information by writing the application, creating the curriculum for 16 new courses, and preparing the program for ACCJC and CAHIIM accreditation. Professor Renda also directs changes and manages the associate degree program in health information technology, which has an excellent and long-standing reputation as one of the first fully accredited programs by CAHIIM in 1968. In addition, Connie has been Vice President of Industry Advocacy and Business Development for Verisma since January 2023. And in her role, she connects the health information and revenue cycle industry with the company as a trusted partner and thought leader. She writes quarterly blog posts on important topics such as human resource challenges, interoperability, and operationalizing regulatory standards for our health information partners. Connie is certified with 2 AHIMA credentials, registered health information administrator, and certified health data analyst. She serves on the Commission on Certification for Health Information and Informatics Management Education Board for exam writing and review committees for both credentials. Her educational background includes a Bachelor of Arts degree from Santa Clara University in psychology, a Master of Arts degree from San Diego State University in psychology and statistics, and a Master of Arts degree from the College of St. Scholastica in health information management and healthcare informatics. She's a native of Long Island, New York, and currently lives in San Diego. And finally, Mara Diker is the Senior Director of the Professional Development Program for the Healthcare Information Management Systems Society, a global advisor and thought leader supporting the transformation of health through information and technology. She's overall responsibilities to define the strategy that contributes to lifelong learning, continued engagement, and professional development for HIMSS members and health information and technology professionals all around the world. Ms. Diker has degrees in both health information management and healthcare informatics. Her career pivot to HIMSS includes health information management and health information technology roles at large healthcare providers, and she's also an adjunct faculty member for Kent State University, where she instructs coursework related to health records management, and she resides in Milwaukee, Wisconsin, with her husband and 2 children. Thank you so much for joining us tonight, panelists, and I'll turn it over to you.
Thank you, Nick. Thank you for the great introduction. And Myself and the panelists, we are very excited to have this conversation this evening. I do have some interaction in our presentation tonight. I hope that it works, but if you have a device and can access the QR code or join at slido.com and enter that code, we would love to understand from you what you are envisioning as your future career as it stands today. And as people begin entering information in here, we will see a word cloud develop. So we have a couple people starting to participate. It's always fun to kind of just get a feel for the audience a little bit. That's a great start for our conversation tonight. It's great so that we can kind of engage with you throughout the conversation. I have a couple of these in the slide tonight, so keep Slido open. So as these are starting to fill in, I'm going to read through just a couple of them. So we do have some direct patient care type roles, OBGYN, emergency nurse practitioner, pediatrician, paramedic, surgeon. OBGYN comes up a couple of times, cardiologist, EMT army medic, dermatologist. And then I'm just looking at some of the other ones that are coming in on what I'll call the business side of healthcare. So healthcare administrator. I saw, let's see, they're moving around. Nonprofit director, that's awesome. So we've got psychology, LPN, pediatric nurse, healthcare technology in there. So lots of different career aspects and aspirations coming across the screen. So I am going to move on from this slide, but please feel free to keep entering. We'll get the feedback from the word cloud as you continue entering those. The purpose of today's conversation really is to help inform you of potential opportunities within the healthcare field. We want to equip you with new knowledge and resources for effective career exploration and guidance. We want to positively influence you in your decision-making process regarding pursuing various healthcare careers, and bolded, we want to help address the anticipated critical shortage of healthcare workers. In tonight's conversation, we are going to pivot towards health informatics and careers in health informatics and what that means. So, as I mentioned, keep that Slido poll open. At this point, we'd love to see what people think of first when they hear health informatics. As part of the conversation tonight, Connie and Emily and I are going to help define this and shed some light on this for you. But you may not have any idea what health informatics is yet, or you may have a really great idea of what health informatics is. And it can be very vast. So we've got medical records and data. We've got a researcher, and I don't know, data analyst, bioinformatics, health information systems, or HIS. We've got a name of a platform, Epic. I can guess that many of you who have received care have seen and engaged with electronic health records and the various vendors and platforms that are out there. Programming. Connie, we see an ICD-10 CMPCS. You'll be talking about that a little bit later. HCPCS, medical stats, nursing, doctor, physicians, health IT, CPT. So we've got some folks that are definitely familiar with nomenclatures and classification systems, so coding, so lots of different things. So I love this. I love that there are many in the audience tonight that have a pretty good idea of what can contribute to the health informatics field. So again, what our purpose with this conversation is tonight is to help you explore different career opportunities and bring some light to maybe an area of healthcare that you didn't know existed, or maybe you've heard about it, but you didn't really know what it means. When Connie and Emily and I walk away from the conversation tonight, what we hope that happens is that we have an audience that's excited about the potential of at least exploring a new career path, and that is careers within health informatics. So we like to start the conversation of just kind of What are you looking for? What do you want to do in your role? Do you think that you might want to solve problems that are related to and may improve patient care? Do you want to be somebody that can help contribute to improving the delivery of healthcare through technology? And do you see yourself impacting the clinical practice workflow? If you've answered yes to these types of questions, health informatics may be a type of career that you want to explore. The outlook for health informatics is very bright. We leverage the US Department of Labor, Bureau of Labor Statistics to pull in some of the information that's in the conversation tonight. But when we look at health informatics and what that can include, it is professions that can be very diverse and unique. So going back to what you all put in as health informatics, now if you take a look at the bullet points on the screen, this is some of the ways that health informatics is defined. So health informatics specialist, software developer, clinical informaticist, solution architect, analytics consultant, medical and health services manager, and artificial intelligence developer. We'll actually dive into a few of those just to provide you with a little bit more depth and context to what those mean. But we also encourage you to explore roles beyond what we talk about tonight. And when we talk about where do folks who work in health informatics, where do they actually work? What's their work site look like? Again, it can be really diverse. So we're talking about people that work within hospitals and healthcare systems. We can see in Emily's background that looks like likely the provider that she works for. Connie is within an academic institution. I am within a nonprofit organization. Physician, dental offices, government agencies, health plans, consulting. We'll actually talk about a consultancy type role. Technology vendors. So going back to our previous slide, somebody entered Epic EMR or EHR. Folks working in health informatics can find themselves actually working for those types of companies. And research. Somebody had mentioned research when they said, I don't know, could research be considered health informatics? Absolutely. So why health informatics? What exactly is it? So health informatics really does blend a variety of fields and competencies. We're looking at cognitive science, computer science, and healthcare science. And as defined by HIMSS, which is the organization I work for, we do publish a dictionary of healthcare terms and definitions and acronyms. We define health informatics as the intersection of clinical informatics and public health informatics. It's one of several fields which compose the interdisciplinary field known as biomedical informatics. Health informatics is the interdisciplinary study of the design, development, adoption, and application of IT-based innovations in healthcare services, delivery, management, and planning. So there's a lot of words there. There's different fields that are brought into that. There's different perspectives. It ends with delivery. We're talking about care delivery, service delivery, management information. You heard in our backgrounds, health information management. What does that mean? And planning. How do we go about implementing systems, utilize systems, participate in the patient care? Emily's going to have a great conversation with you about her role and what a day in her life looks like. So when we think about health informatics and you're thinking back or sitting back and thinking about, could this potentially be the type of role for me? When we look at health informatics, again, the career opportunities are vast and diverse. I like to explain to a lot of people that the technical skills, to some extent, can be taught. Every organization is going to deploy processes, operational effectiveness in different ways, and that can be taught. If you talked to Emily or Connie or I about how our organization does things, how we contribute to that, it is going to be different. What we're looking for in folks that are working in the field, students, future emerging healthcare professionals, we're looking for those soft skills. So when we talk about health informatics, some of those soft skills that resonate with individuals working in this field are folks who are good at communication, both written and verbal and nonverbal communication as well. That's really important. Problem solving. Do you like working through problems? Do you like looking at a situation and coming up with different approaches to potentially resolve that problem or come up with that solution? Problem solving is a huge piece to what we do in health informatics. Strategic thinking actually kind of goes hand in hand with problem solving. Team building. Most of us, there's very few of us that are working in an independent silo. Even if you're very introverted, you can find roles within health informatics. Those might be some of those more individual contribution roles. But typically, we are working with other individuals, whether it's teams that we work on, whether it's teams we work with. By background, I spent 10 years doing EHR implementations in a provider care organization. I was directly working with the providers who were using that system. So I had to work within a team of other analysts like myself, but we were also working with the healthcare team as they were delivering those services. Resilience. There's a lot of change that goes on in our field, how we respond to that, how we manage that change, all goes back to resilience, attention to detail. HIM professionals are very much known for their attention to detail and that type of personality. Critical thinking, emotional intelligence, great time management skills, and a really strong work ethic. So if these are skills that you see yourself embodying, might be a good fit for health informatics. So what are some of the job opportunities? Going back to that word cloud of where you all were putting in, what do you think of when you think of health informatics? We saw some of these responses. And this is definitely not a comprehensive, all-inclusive list. These are some examples. Clinical informaticist, artificial intelligence, we hear that all the time around right now. That is definitely impacting our field. Solution architect, developer, health informatics, analytics consultant, services manager, software developer. Diving into, I think there's 4 examples that we want to share, and then I'm going to turn it over actually to Connie to talk about a little bit of education and different entryways into the field. But just to give you an idea of some of the roles and the diversity. So health information technician, again, we're pulling this information from the Bureau of Labor Statistics. But what they do, they're the folks that are managing and organizing health information, data, ensuring that it's complete, that standards are met, that the integrity of the data is secure, the privacy of the data is secure. Some key skills there, so software, customer service, data analytics, coding, folks put coding in. Coding can take a couple different meanings when you're looking at our field. I have some salary information and some job outlook. You will see a trend when we talk about job outlook. Careers in this field are growing at a very rapid pace. Some general requirements, associate or bachelor's degree, some knowledge of some of the different competencies. Some previous experience can be helpful, but this actually can be a great entryway into the field through a health information technician type role. And previous experience using some sort of EHR or some sort of software platform can be really beneficial as well. A second role to just kind of show progression as a medical and health service manager. This is going to be a people leader type role, maybe a promotional type opportunity. So these folks are typically overseeing teams and they're overseeing the compliance of healthcare laws and regulations. They're making sure that provider organizations are meeting all the standards. Financial backgrounds, analytical, technical, problem solving. Again, some income information on there. Job outlook, the last one was 16%. This one is expected to grow by 29% over the next 10 years. Very bright outlook for this type of role. I have some general requirements over there. Typically, this type of role is going to require a bachelor's degree, oftentimes a master's degree preferred, just for some advanced competencies. Definitely some background skills and education and experience within healthcare facilities, provider organizations. But you can get into the economic side of it. You can get into healthcare law. For a really long time, I thought I wanted to be a lawyer and practice healthcare law. Licensing, credentialing, you heard both Connie and I hold some certifications within the field. Connie's actually going to share a little bit more information about that. And some experience, obviously, in that provider clinical type environment is really important to this type of role. I mentioned consultancy, and I think somebody put that in as well into the word cloud, and it was on the opportunity slide. But if this kind of, we hear the word consultant a lot, it is definitely something that's within the healthcare informatics field too, if that's the type. I look at consultancy as kind of a mover and a shaker type role, folks that like to be out doing a lot of different things, be busy, have a lot of different perspectives, different clients, different inputs, opportunities. So a lot of times these folks are helping lead the development, the design, the implementation of new systems, new platforms, new ideas, new processes. Again, some key skills, background information and data processing, problem solving. Consultants have to be quick on their feet. We are looking at the consultants that we bring into these organizations to help us problem solve. That is probably the most critical. Time management's really key. They're working on a lot of different projects at the same time, managing a lot of different ideas and a lot of different inputs. Income range, some general requirements, typically bachelor's. Really important, at least from my perspective, for consultants to have some experience. How can you share with me best practice and new ideas if you haven't been boots on the ground before and had an opportunity to live through some of these experiences and bring those best practices and tried and true pathways to me? So definitely strong communication, interpersonal, and leadership skills in a consultancy type role. And then the fourth example, again, just to kind of show you the depth and the breadth, I pulled a C-suite level. So this is more of an executive type role. It might be something that we aspire to be in the future. So as I mentioned, executive role. In this case, these are the folks that are leading, securing the information of the organization and the business. Strong written and oral communication skills, business management, problem solving again, much higher salary range. We are talking an executive level. So I wanted to show you the potential of where you can go in this field. Bachelor's degree, likely a master's degree. Like Emily's MHA, Master's in Healthcare Administration, great pathway to these types of executive roles. Definitely a lot of industry knowledge when you get to this type of level. IT certifications are definitely preferred. And in this case, of course, some background experience in education as it relates to security management. So again, just to show you four pretty different roles that can build on top of one another, just to show you that depth and breadth. Kind of to summarize what I just showed, this is a visual of a compilation of what's pulled from those labor statistics. So high job growth outlook, we do have this one sorted based on median salary, just to give you an idea of what that salary range is. And with that, I want to turn it over to Connie to talk a little bit about how do I get there? This sounds interesting. What are my pathways? What are some of those resources that I can look into that might help me learn more about this?
Thank you, Maura. So I know all of you are looking to someday have these great jobs that Maura's talked about. So the first step is always education. And the best part about education is, you can lose a job, you can lose your car, you can lose a lot of things, but you can't lose your education. You have that once once you have that, you have it for your whole lifetime. And it builds, you can build upon it, you can get multiple degrees like Mara and Emily have, and really be successful in whatever career you want to be. And I think it's hard when you're trying to figure out what to do education wise, especially when you're young, which I think all of you were in high school that we're talking to. So, I definitely didn't know anything about this field when I was 17, 18 years old. And which is why I have 2 master's degrees. I sort of switched paths, and that's fine. I think the key is to get on a path, head down that way. If you like it, great, stay there. If you don't, you can change it. And a lot of the education that you will receive will be very much transferable to other careers and other professions, and really anything you learn. And that's part of the reason we have general education, like history and math and science. You think, well, I'm not really going to go into history. Why am I learning that? All of that contributes to your intellectual growth and your ability to be a successful person in our world. So don't think of it so much like you're in a box and you have to decide what you're doing today. Think of it very much as that it's a growth opportunity and having that lifelong learning mindset. So with that, as an educator, of course, I'm going to be biased in that regard, but I'll give you some just ideas of some of the things that we offer in our district. The other thing I'll tell you is many of you will go on to 4-year schools. There are lots of great opportunities at community colleges. There are community colleges in every single state. And what's great about them is often they're free or very low cost. And especially for those first 2 years when you're doing your general education pathway, it's a great way to start, save a little bit of money, have some really great education, and then be able to transfer to other schools where you might complete your education. So I'll talk just a little bit about what we offer at our school. We're part of a 4-college district in San Diego, California, which is in the very southern part of California. And we are called the San Diego Community College District. So my college is one of those 4, and it's called San Diego Mesa College. And what we offer at Mesa College isn't offered in the other 4 schools, but is offered in about probably 10 other schools in California. So you'll be able to access that. And again, this is offered pretty much in every single state in the US. I don't know about international programs. I know there are lots of programs in Canada. I don't know about other states. Or other countries, excuse me. You'd have to look that up. But speaking from, my college and our state, what we have is this is an example of a pathway. So let's say you wanted to start out and you think a coder sounds kind of good. Maybe I want to be a medical coder. That is something that doesn't require a degree. It requires certain coursework to be accomplished. And that coursework is related to medical terminology. It's related to pathophysiology, anatomy and physiology, and then the specific coding courses, like some of you had put on that word cloud, ICD-10, diagnosis coding. And then we also have CPT coding for the outpatient side, or the doctor physician coding. So those, you learn the sort of the fundamentals of that, a little bit of insurance procedures, and then you go, okay, I'm going to stop here and go be a coder, and that would be sufficient. The next step, if you decided that wasn't enough education, which it sort of is becoming to the point where the more education that is necessary, especially for those high-end jobs that Mara talked about. So the next step, you would enroll in the associate's degree program. You'd take all of those courses that you took in the coding program and apply them to the associate's degree program. And you'd get an associate of science degree in health information technology. There you would expand on your coding skills. You'd also look at health data management, start looking at healthcare systems, and like Epic was one of the things that came up. Privacy, very high focus on privacy, confidentiality, and a little bit starting to get into the revenue cycle and reimbursement process and procedures that happen in healthcare. If that's not enough and you maybe start working in the field at that point and decide the next level step up in a career might be a bachelor's degree. You would take all of those courses you took in the certificate and the associates, apply them to the bachelor's degree, and you do another typically 2 years where you advance those skills in health information systems, administration. You'd learn more about management. It's really a management degree at that point. Probably more like a healthcare administration role where you would learn things like leadership and strategic planning, project management, finance, healthcare finance. So analytics, informatics, human resources management. So very high level kind of management roles. And again, very transferable to other fields, but specifically you would learn them in healthcare. Okay, and then next slide, please. So the certifications that we have mentioned along the way here, there's lots of different ones. The AAPC is the American Association for Professional Coders, and they have many certifications based on primarily where the coding takes place, whether it's inpatient or outpatient. And that's a great organization to be certified in. And that would be either through the coding certificate program or the associates program. And then we also have another organization called the American Health Information Management Association. They offer some coding certifications as well as other certifications related to health information, privacy, CDI, analytics. And so, and then of course there's HIMSS certifications that are related to more on the IT kind of, I almost say higher level, but a definitely more technical area of healthcare, and probably a little bit higher regarded than the other two, just in terms of the way that jobs are in the field, especially for higher paying jobs. So it's kind of in that order, if you will. Okay. So those are certifications that you can get. And there's many others, but that's just some. The Healthcare Finance Management Association also has some certifications that are applicable to revenue cycle specifically. Okay. And then there are, again, more certifications that are more general. AWS certification paths, you'll see there are things related to kind of more software, computer, cloud computing applications. Again, if you're a computer person, these are great certifications to obtain, and they are often required for particular jobs. So you'll have to see what your job requires. Typically, if you get the education when you end up in a job, they will require certain certifications. Or if you're looking for a very specific certification, then you know what job you need and what the certification is for that. And there's also these Google career certificates. And I think some of these might be no cost or pretty low cost certifications too. And there's the links to at the bottom of the page for those. Okay. So I mentioned the AHIMA organization, the American Health Information Management Association. They have a really nice career map, and that shows you exactly how you would map out your career. So you would look at entry-level positions in the middle, and then all the way out to like a master's level or high-level job posting. And what's great about it is when you click on these little buttons here at each of the places, you'll see that this pops up where it gives you the job description, the responsibilities of the job, what kind of training and education you need or experience, and it gives you some resources. You can take those job titles and put them into like Indeed or Glassdoor, one of those salary kind of finders, and you can see what kind of salaries are associated with each of those jobs in your particular area. There are a lot of remote jobs in health information and informatics, but I wouldn't assume that you're going to be working remotely from the start, especially. So I would be prepared to be on site. It's good practice to be on site somewhere, even if you're working remotely, dressing like Nick does to be on camera is a great presentation of yourself, especially when you're a young professional, trying to show that you are a professional. You can, take a shower and comb your hair and do all the things that are nice to see on a camera or in person. And then, you can escalate from there. There are a lot of places when you start working that are fine with you wearing a t-shirt and jeans, and that's wonderful. But again, don't assume that from the beginning. Assume kind of the higher level and then go down from there if you want to. And that's your personal decision on that. Okay, so those are some career path ideas. Some other tools are within HIMSS, also has a similar career pathways tool that you can see the entry level, mid-level, advanced within those health information management systems jobs. So you can see the qualifications that are needed. So they're kind of like basic little job descriptions. And then if you're on LinkedIn or any of those where you can see jobs, you can identify actual jobs and kind of compare them back and forth, see what might be missing from your resume that's necessary to get to the next stop of your career. Next step, I should say. No stopping. And then I'll turn it over to Emily to talk a little bit more about being in industry and working in the real world.
Emily, I believe you're on mute.
Thank you, Mara. Hello, everyone. So my name is Emily. I work as a ambulatory call center supervisor with UCSF Health in Northern California. So for those of you that are looking into sort of an ambulatory administrative healthcare role, this might be something for you, especially if you want a hybrid, flexible role where you can work both remotely and on site. It might be for you. So basically, what does my day-to-day look like? I always start off with task prioritization because I have a lot of moving parts to my role. Did I run my call metrics reports? Did I do my call monitoring? What meetings do I have today? Are there any patient issues that I have to address? Any conflict resolutions that I have to address? Team member onboarding, a bunch of these, a lot of different moving parts. Not trying to scare you with this long list of responsibilities, but that's sort of my day to day. And I think anyone can actually take on this role as long as you have an open mindset in terms of learning and just growing your soft skill set. That's how I got into this role. And just some soft skill sets that I think are ideal to an administrator position is task prioritization, like I said, communication, team management, data analysis, work delegation, problem solving, adaptability, and interpersonal skills, just to name a few. And these are skills that you can actually pick up along the way through volunteering or internship opportunities, as well as just by simply taking on leadership roles within clubs at school. These are soft skills that you can pick up along the way. And on this slide, you'll see sort of how I got to where I am currently. And you'll see that I actually did start off and did my general education at a community college. At that point, I knew I was interested in chemistry. I knew I liked math. So I knew but I didn't like English. I didn't like history. I knew I wanted to do something along the lines in science or math. And at that point, I was recommended by my counselor, like there are volunteer opportunities in like healthcare settings, and that's sort of when I took on the opportunity to volunteer at one of my local hospitals in San Francisco. That was Dignity Health Hospital, and I started volunteering there. Then I graduated in 2015 from the community college, actually, with an AA and AS degree, and was admitted into a 4-year institution, San Jose State University, for a molecular biology degree. But you will see that when I graduated in 2018, I actually graduated with public health. And during that time frame, I was like, I don't think I want to be in labs all day long. So I made the switch. I ended up minoring in chemistry and then actually making the switch to a public health degree where I learned about social determinants of health. Why is it easier for some people to get to their doctor's appointment and to get their food, whereas other people, it's harder for them to get to their doctor's appointments or get food. Are they worried about food? That was my sort of my undergraduate experience. And then you'll see that in 2017, right before I graduated from San Jose State, I was actually hired part-time by the same institution that I was volunteering at for as a practice coordinator, and then sort of worked my way up. And then in 2020, I actually decided to leave my role at the institution and actually took on a practice coordinator role with UCSF Health. Um, and then and then at that point I was like, I don't think I have enough experience sort of in this role, and I don't understand all the business side of things. So I decided to decided to get a master's degree in health administration, and then eventually I got promoted into the role that I am in today.
Thank you, Emily, for sharing your background and how you got to where you are. If you don't mind, I'd love to ask you a few questions to provide some additional background on how you got to where you are today. So the first question is, on that previous slide we were just on, you shared some of those major milestones that got you to where you are today. But was there anything in particular that really affected your career trajectory? Was there you mentioned volunteer, was there a volunteer opportunity or an internship or a specific experience that you look back on and say, wow, that really did affect my decision to take the path I've taken?
Yeah, certainly. Again, it was the voluntary experience. But as I said, I did go the community college route because at the time when I graduated my senior year of high school, I didn't know what I really wanted to do. I liked computer science, I liked math, I liked healthcare. I was like, what, what what course can I take, what degree or what roadmap can I possibly do? What road did I want to do? I didn't know any of that. So I went the community college route, and then I started volunteering at my local hospital. I was like, I didn't know anything at the time, but then I began helping with like medical records management, even scheduling appointments. And I was like, I did like this aspect. I did like, I do like doing all this medical stuff, but I knew I didn't want to be a doctor. I didn't want to be a nurse. I couldn't just deal with all the upper division science courses. So I was like, maybe like the business side and like the administrative side of healthcare is where I wanted to go. So definitely the volunteering that sort of pointed me in that way. And then along the way, I was figuring out which exact administrative roles did I want to take on. And I was like, I do like the practice coordinator role, but I feel like I do want to also be more in the business side of things. So I slowly worked my way up into a sort of a leadership position.
Great, thank you. I can't emphasize the importance of putting yourself out there, getting some experiences, volunteering, building your network, taking advantage of internship opportunities, because those are really the types of things that help you kind of know commitment, make some decisions that can really impact where you might want to go. So take advantage of those opportunities. What drew you to healthcare? You've kind of dabbled in it a little bit. You've told us what you didn't want to do and why, like in regards to really enjoying math and science classes. But when did you really realize that healthcare was the place for you?
I did realize, I think even as like even when I was in elementary school, let's just say I wasn't the healthiest kid on the block. I was always going in and out of hospitals and going in and out of clinics for appointments, and I was always amused at the people sitting in the front, like what was going on around in the background. I always had a link sort of towards healthcare, but at the same time, I also had interest sort of in like computer science. And I did do actually an internship back in high school, my junior year, where I was actually introduced to bioinformatics. I think was one thing that was mentioned in the word cloud, where I was like, maybe that could be for me. And I did sort of do a few introductory classes when I was doing my undergrad studies, but eventually I was like, I don't know if I want to be doing all this coding at all. So then so as I continued volunteering, trying to figure out what I wanted to do, I knew did enjoy the practice coordinator aspect. And I had a mentor when I was volunteering, and she's like, well, you have all these options. Maybe you want to try looking into a leadership position, in which she had me attend some leadership meetings for the department, sort of putting me in that role, like what would that entail? And I was like, this is something I would like to do. So that's sort of when I knew I would like to go into like a healthcare administrator role.
So I hope you all heard Emily bring up another very important word, which is mentor. Find yourself a good mentor. Find yourself multiple mentors. These are folks who are going to help guide you in your decisions. They're not going to make decisions for you, but they're going to provide you with opportunities and experiences and feedback that will help guide some really important decisions in your life. So it's really critical to find some trusted mentors and sounding boards for your career. And your mentors will change throughout your career. At different areas and different times in your life, you'll need different types of mentors than you did 5 years ago. So keep that in mind. So Emily, even though you're not directly administering hands-on patient care, like you said, you didn't have a desire to be a nurse or a physician, do you feel like your role today is making an impact on patient care, and why do you feel that way?
Yes, definitely. When patients give my team a call, they're looking for a primary care doctor, and oftentimes they don't know how to navigate the system. And just to put some terms out there, for insurance purposes, you have HMO plans, which restrict which providers you see. You have PPO plans and EPO plans. A lot of these patients that are calling in, they don't know what an HMO plan means. And when you tell them, oh, you can't be seen at UCSF, they don't know why. And a lot of times you're making that connection and sort of educating and helping them navigate their healthcare. Me specifically, I love to make connections with patients. And like when Nick read my bio earlier, I mentioned that I am very passionate about helping non-affluent English speakers get the care that they need. Oftentimes, if you don't speak English, it's very hard to find a doctor. Me personally, I am bilingual. I do speak Cantonese and also some aspect of Mandarin. So I do like, making connections with these patients and helping them really navigate their healthcare, and getting the medical care that they need. And a lot of times these patients are very appreciative. And like, can I be your friend? I'd like to, bring you something. I like to do this. And I really appreciate, and I really just like that connection aspect that you can get with patients in my role.
Yeah, absolutely. And I think that that's a really important key to take away from this conversation too is, even though folks on the business side of healthcare or the administrative side of healthcare might not be administering direct patient care, we all play a really critical role in that patient's care cycle. If there aren't people managing that in the background, healthcare systems would quickly fail. So if you don't think that this is the right path for you because you want to be involved in patient care, I just want to really drive home the fact that we are involved in the patient care aspect as well. So thank you, Emily, for that. And one final question before we open it up. We've been answering some questions in the background, but we want to make sure if the audience has additional questions they can ask. So final question for you. If you could share one piece of advice with those who have joined us tonight or who will listen to this recording on demand, and they're considering the business or administrative side of healthcare as a potential career path, what would that piece of advice be?
I would say to really start looking into internships or volunteer opportunities and just try out different areas of, healthcare administration. These are, these are things you can build on hands-on skills during the internship or volunteer opportunity. And that's when you can really know, which career path do I really want to take? And oftentimes, again, this leads you to have, even an external mentor that you can ask, for advice about, how did you decide to take this career path? I think it's just along the way, and also be open to learning skill sets. I think is a key is a key piece of advice I can give to you all.
Well, thank you, Emily. I think that that was a great conversation just to offer one perspective in the field. I mean, we could do this for hours with different individuals, but I really appreciate that you took time out of your day to share just a little bit of what your day-to-day looks like. So with that, just to kind of conclude this conversation, and we'll move on to sharing our contact information so that you can reach out. We also have a slide in this presentation that talks about some of the resources Connie mentioned, for example, KHIM. But in conclusion for tonight's conversation, we really hope that you walk away with an understanding that roles in health informatics blend both the business side of health, the business side and the healthcare side. I think we've said it a number of times now that we do have a direct impact on patient care, even though we might not be administering patient care at the bedside. And another thing from this conversation is there's many different career pathways. Connie showed you a couple of tools. There are other ones out there. Again, we had to kind of be selective in what we were sharing tonight. But go out there and explore those tools and resources just to get a better idea on that AHIMA career map that Connie shared that was organized in kind of segments of the industry. You can see kind of the progression of careers. You can go get job descriptions, understand the types of skills that folks in those types of roles are expected to have. You'll find out educational background. You can look at job postings to get a better feel for that. But there are so many different career pathways that you can look at depending on what is interesting to you in this field. So I'm opening it up for questions for sure. As I mentioned, we've been trying to answer a number of them that have been coming in through the chat. While we're taking questions, I have a contact us slide here. I'm going to pop over just to show you this slide that Emily and Connie and I compiled of various resources. There's a lot more out there. But for example, Connie even mentioned in the chat, KHIM, that's a great resource for looking for different programs, certificate to PhD programs, master's programs, online, in-person, or on-campus programs. We listed out a variety of professional associations, some that we directly spoke about in the presentation tonight, but other ones like Connie referenced HFMA, even though we didn't have any specific information pulled from that site, we wanted to get you out to that site. ACHE is another great resource. They have a handful of career resources out there. We did put some specific links to our programs out here as well if you want to learn more about them. But I'll back up to this slide so that you can pull our contact information. We are open to having you reach out to us with any additional questions. But Nick, I'm sure you've been monitoring the chat as well, and we only have a couple of minutes. Are there any questions that you saw come across that multiple people had or might really add to the conversation?
Yeah, I see one question. I know a couple people asked about mentors. Somebody in the chat, looks like somebody in the chat's responded to that one. And we have another question. How do non-clinical healthcare professionals stay up to date with what's happening in the industry, health informatics, healthcare in general, and just some of the advancements such as AI that you spoke about?
Yeah, so I'll take a first pass on this one. So staying up to date in our field, very critical. Things are moving at a very rapid pace. And organizations like what we have on the slide here, having a relationship with these organizations, understanding the types of resources that they can provide can be a key way to keep yourself up to date. When we talk about professional certifications and licenses, those often have requirements for continuing education. So you are pushed, not that we really need the push. A nudge is nice every once in a while, but they really do require us to stay up to date on the knowledge. There are so many resources, great periodicals that are out there. I have some of those come right to my mailbox every single morning, sometimes more than once a day. That just keeps me up to date on what is going on, what is hot off the press. A lot of these associations have publications that they're sharing information. There is no lack of ways to go about finding information. Make sure you're using a reliable resource. Connie or Emily, would you have anything to add on staying up to date in this industry?
I can take a stab at it, or
Yeah,
Connie,
go
you
ahead,
want to
Emily.
go first? I would say like like I said, these like Mara said, for those organizations there are oftentimes student memberships that are at no cost, and with those student memberships includes webinars that will keep you up to date on what's happening in the healthcare industry. I also, when I first joined HIMSS, I got the opportunity to participate in project and event management, and I also got to attend my first HIMSS conference, which was another great way where I got to continue my continuing education and learn more about what's going on in the healthcare industry.
Connie, what do you have to add?
Yeah, agreed. I think that there's a lot of great things opening for students all the time. There's scholarships. I know HIMSS does a really nice student scholarship too, and go to their conference every year. There's a lot of different opportunities locally. Just check with your community college or even like your hospital to see what events they have that you can attend for free. But definitely like keeping up on, I mean, webinars are great. I would say there's just even through like LinkedIn, if you're not on LinkedIn yet, you probably don't have a lot to put on there, but you can definitely search on there. And I put a link even to finding a mentor, just to put like a profile on there and then just type in the subject of what you're looking for, and people will pop up that are in your area. And you can just reach out and say, I'm a high school student and I'm looking for a mentor. I'm looking for somebody to help me figure out what to do in this field. And they might say, hey, why don't you come to this event with me next week and I can introduce you around. I mean, I have no problem doing that when somebody wants to tag along, even my current students who want to tag along to like our state convention for the state I'm in. They'll come to the convention as volunteers, and then I'll introduce them to potential hiring managers, and that's how they get jobs and learn, just even to have a conversation with somebody and practice like shaking hands appropriately and having eye contact. There's a lot of things we don't do in person anymore, and so anything you can do in person, especially as you're developing at like a younger person, although I have older students who are in their 30s and 40s who still have issues with communication. And so practicing that and being in a public setting is the best thing you can do. I hate to say like talk to your parents and their friends, because I know you probably cringe at that idea. I know my kids do, but that's really a great way to, again, practice your communication skills, find out what they do for a living. Oh, tell me what, tell me about your job. And then you go, oh, I would never want to do that. And then the next person, oh, okay. Finding out what you don't want to do is just as important as what you do. So just getting an idea of how you want to approach your next few years. And again, you can change careers. You don't have to do one thing for the next 80 years. You can do a lot of different things.
And just looking at time, I think that that's a great thing to end on, getting connected, different tools and resources to utilize for that. I know that there are a couple other questions that came through in the chat. We will work with HOSA to provide responses to that, but please connect with us on LinkedIn. We can be mentors for you. You're welcome, Emily and Connie, for volunteering you. But we'd be happy to
Happy.
connect and answer questions. So Nick, I'll turn it back over to you to close us out.
Thank you, Mara. Just want to remind folks that this session has been recorded, so we'll post it and email the session to you. You'll also receive a certificate of participation for attending tonight. It'll be emailed to you within 24 to 48 hours. And thank you so much again to our wonderful panelists, and thank you to HIMSS for supporting this session. We appreciate you all for joining us and participating in this session, all of our listeners on tonight's call. And we want to be sure that you're aware that HOSA has a health informatics health IT competition called Health Informatics. So if you have an interest in the area, you should definitely check that out online at hosa.org, or hosa.org/guidelines will take you right to the page with more information about Health Informatics competitive event. So thank you so much for joining, everyone. Have a great evening.
Thank you.
Thank you.
Thank